Talking about measles tonight, once thought to have been eradicated in the U.S., it continues to make a comeback, and this time we're seeing it here in the Bay.
Though there's no outbreak at this time, a Contra Costa County resident has come down with the illness and may have exposed an unknown number of people prior to Christmas. KRON 4's Dan Kerman reports.
The Macy's at Walnut Creek's Broadway Plaza, the Apple Store at Broadway Plaza, the Anthropology across the street, and Kaiser's Walnut Creek Emergency Department. These are just a few places frequented in the days before Christmas by a Contra Costa County resident who has come down with the measles.
Because it's airborne, one, and then two, is highly contagious. The individuals who need to be most concerned about are individuals who are not vaccinated, and especially infants under the age of 1. Anyone who has only received 1 dose of the vaccine.
Health officials say those with measles are typically infectious 4 days before and 4 days after the rash shows up. That's why those who have not had the measles or received 2 doses of the U.S. vaccine should watch for symptoms which initially mimic other illnesses.
Generally, a person will present with initially a high fever, so in the range of over 101, sometimes as high as 103 degrees.
The infected person was vaccinated outside the U.S., so it's unclear how effective that vaccine was. The person, described as a young adult, is now recovering and did not have to be hospitalized. But that's not always how it goes.
We've already had 3 deaths this year from measles in the United States. Measles is a very serious disease, not just because of the deaths, but because it can cause lots of complications, some of which, for example, brain damage, can be permanent.
Measles was declared eliminated in the U.S. in 2000, but in recent years, fewer children have been getting the vaccine, and that's led to a rise in cases.
As we have more people that are not protected against measles, we're going to see more of those get infected.
And while measles cases has led to outbreaks in various cities across the U.S., infectious disease experts say that's unlikely to happen here in California.
But we're not going to see as many as we see in many other states. And the reason for that is our vaccination status is much better than many other states.
Dan Kerman, KRON 4 News.